most people can readily accept that civility is bringing our best selves to those cultures and to that practice, and deepening the definition to include such concepts as respect, being able to communicate with our colleagues and coworkers at a meaningful level even when we don't agree with what they're saying, being able to honor them as individuals, being able to honor their own needs while having our personal needs met too. You know, what kind of a person do you want to be in your local culture, in your team, in your department? How do you want to come together and interrelate with others in a way that's positive and respectful? How do you want to create or let's say, what kind of a climate or culture do you want to create? Whether it's locally in your department or in your whole hospital, or indeed, and I think a lot about this too, beyond into the culture of medicine itself.
What are some of the consequences that you see of incivil behavior, both, you know, at a more individual level and more broadly among the medical and other health professions?
Well, that's the question that I'm often asked. What's the impact of incivility? But maybe before I talk about those things, I'd like to flip that around on you, because that's what I'm trying to do. I'm trying to move away from the whole conversation around disruptive behavior and talk about civil behavior. So what are the impacts of civil behavior? So in a civil workplace, what's that like to come to that place to work? Well, you wake up in the morning, and I'm very fortunate, I can claim this for myself, working in this very office. Wake up and think, okay, what's on the plate for today? And I feel good about setting out into my day professionally. I'm looking forward to being with the people I work with. I respect and admire the people that I work with. I'm looking forward to being with them. We share a positive energy. We respect each other. We, at some level, care about each other. We support each other when we need that kind of support. We confront each other in a respectful way when that's important as well. We know each other's names. We treat each other in a way that feels comfortable. So now you can take a look and see what's it like when civility is absent. Well, that's not a nice place to get up and go to work, and people feel drained, not energized. People walk on eggshells and careful what they say, and always concerned that they're maybe judged. Feel that their own personal needs or their own personal viewpoints may not be perceived, respected, acknowledged. May feel that the emotional environment is not one of perhaps compassion or understanding. It's a place of tension. It's a place where morale may not be its best. It's a place where people may come and go. There may be high rates of turnover. It's hard to settle into a cohesive, highly functioning team. And you can understand, of course, that this is not really great for the highest quality of patient care, which at the end of the day is what we're, at least in the medical and healthcare professions, it's what we're all about.
Ultimately, how does civil behavior have a positive impact on patient care?
At some level, it's intuitively obvious. If each of us feels energized at work, if our teams function well, if the morale is high, naturally we'll be well focused on bringing our skills collectively and individually to the task of patient care in an optimal way. Yet, how many times have I found myself having to say that and having to remind many of the doctors that I speak to who paradoxically defend or explain their choices for what's clearly an uncivil kind of behavior as being in the name of high quality patient care, not understanding that it's in fact the reverse. That's why I call it a paradox. They honestly believe that by yelling at somebody, swearing at somebody, cajoling somebody in a harassment kind of way or an intimidating manner. It will get them to be their best. I'm afraid sometimes we're taught that way at times. And I know that that continues to be the case. But when people are hurt, off-put, and then try to avoid working with that particular individual in the future, none of this is good for patients. If patients observe this sort of behavior, it's not reassuring for them in terms of the quality of care they're about to receive. And there are also, as we've learned, and research is showing this, there are more subtleties related to the impact upon patients, and the positive impact upon patients when we are civil and when we are satisfied with our work, which civility leads to, when we have looked after ourselves well. Again, civility as a fundamental self-care would lead us there. All has a positive impact on patients. For example, one researcher, Erica Frank, has shown us that doctors who look after themselves well, who actually live healthy lifestyles, as we're encouraging others to do, will indeed encourage others to do that more often, and that are credible. And you tie all that to the fact that advice given by a doctor to a patient is very powerful. Our patients care about what we have to say. Then there's a higher likelihood that that positive message will be delivered to patients and followed. And there's also some other research that shows that patients are sufficiently sensitive and intuitive to how we are at work. And they know if we're not feeling professionally satisfied. It shows. And it also shows in this research that patients who perceive dissatisfaction in their doctors feel less satisfied in the quality of care or less comfortable with the quality of care they're receiving, and reverse. So when the doctor is clearly coming to work and interacting with patients from a place of professional satisfaction, that transmits to the patients who feel more satisfied with the quality of care they're receiving. Once again, everybody comes out ahead when we can bring civility and civil practices to our profession.